This case begins with a 34-year-old male that presents with agitation, difficulty swallowing, and just feeling afraid of water. The patient reports that 10 days ago he was bitten on the right hand by a stray dog while traveling internationally. He cleaned the wound but did not seek medical attention. Over the last 24 hours, he has become increasingly anxious, restless, and hypersensitive to sounds and drafts of air. He reports painful throat spasms when trying to drink water and says even the thought of swallowing makes him panic. He denies fever initially, but now notes chills and severe fatigue. He has no significant medical history, does not take any medications, no prior rabies vaccination, recently returned from rural India, works in IT but has no occupational exposures, and lives with his wife and 2 children. His heart rate is 132. His blood pressure is 148/90. He is breathing 26 times a minute, but has a temperature of 102.4 Fahrenheit and is satting 98%. He is visibly agitated, pacing, sweating, and intermittently gagging when attempting to swallow. On physical exam, he appears extremely anxious, intermittently combative, and difficulty following commands. He has throat spasms on attempting to drink and has hydrophobia. He has fasciculations, hyperactivity, periods of lucidity alternating with panic, hypersalivation, and aerophobia, which is throat spasms induced by air blowing across the face. He has a healed dog bite on the dorsum of the right hand. He appears tachypnic and tachycardic. What is the diagnosis? Hydrophobia plus aerophobia after an animal bite is pathognomonic for rabies. These throat spasms are triggered involuntarily with attempts to swallow liquids, or even the sensation of water. Rabies typically progresses through 3 stages: a prodrome, an excitative phase, also known as the furious rabies, and the paralytic phase, also known as dumb rabies. The prodrome is days 2 through 10. It consists of fever, malaise, and paresthesias at the bite site. The excitative phase is where you see the hydrophobia, the aerophobia, the agitation, the hallucinations, and the autonomic instability. And the paralytic phase is where you see flaccid paralysis, coma, and possibly death. Rabies cannot be ruled out clinically. The diagnosis includes PCR of saliva, a skin biopsy from the back of the neck in the nuchal area, CSF testing, serum antibodies, or animal testing if available. However, testing results should not delay treatment. To diagnose, you must have a high clinical suspicion. Again, a dog bite plus hydrophobia plus aerophobia plus neurological dysfunction is rabies until proven otherwise. One way I like to remember the 4 diagnostic criteria is the mnemonic HAND for hydrophobia, acrophobia, neurological dysfunction, and dog bite. Pathophysiologically, rabies virus enters through the bite wound. It travels via retrograde axonal transport to the central nervous system. It replicates in the spinal cord and brain, causing an encephalitis. Once it spreads to the salivary glands, it produces hypersalivation. It then causes pharyngeal muscle spasm, which leads to the hydrophobia and the aerophobia. And ultimately, it leads to respiratory failure and death. The treatment of rabies really depends on if there's neurological symptoms or not. But once neurological symptoms appear, the rabies is almost universally fatal, and management focuses on supportive ICU care. But exposure without symptoms, you must treat immediately. There is the rabies immunoglobulin, the RIG, which is infiltrated around the wound, the rabies vaccine series, which is given at days 0, 3, 7, and 14, and thorough wound cleaning. For prevention, pre-exposure vaccination for veterinarians, travelers, and lab workers is a good idea. Post-exposure prophylaxis following any suspicious bite. Immediate wound washing dramatically lowers the risk, and the use of animal control and vaccination programs. I can't say it enough. A patient with hydrophobia, aerophobia, hypersalivation, agitation, and recent animal bite, I want you to think rabies immediately, and this is a medical emergency.